So today we're going to talk about the axial skeleton. Axial skeleton versus appendicular skeleton, which you guys should know. Axial and appendicular makes your whole skeleton. So axial is like an axis. So you have your skull, your vertebral column, thoracic cage, and the thing that everybody forgets is that you have a sacrum. Please do not confuse that with the structure of the pelvis. So the pelvic bone are different than the actual what? What is this that I'm painting? Sacrum. Even though you always see it together, they're not. Okay, so on the appendicular skeleton is divided into one on the top, one on the bottom, right? The one on the top is known as the pectoral girdle. That's why I have two pieces here. So pectoral girdle, which is composed of your what? Scapula and clavicle. Okay, the other, which is the humerus, the radius, and the ulna, your carpal, metacarpals, and phalanges, those are going to be part of your upper extremities. Okay, and then you have your pelvic girdle, which is composed of your what? Your pelvic bone, and your pelvic bone is divided into three parts. What are those three parts?
Pubis, ischium, and
So you have your ilium on the back, so posteriorly, ischium, and on the front, pubis. Everybody got that? So three. So there are three in one. Okay? Now that's what makes your pelvic girdle. Now attached to the pelvic girdle, then you have the following bones, right? Which is your femur, tibia, fibula. Between those three, well, actually not between those three, between those two, mainly, you form what? The knee joint, right? And then, yes, on top of that, you have your patella. And then you have your tarsus, metatarsals, and phalanges, right? So expect to see questions coming from what bones are located with their actual appendicular, etc. Here it is. We're looking at the skull. And everybody's panicking because they see a lot of words. Am I correct? All I'm saying is the stuff that you guys already know or should know from the lab, which is your skull is composed of what? Face, cranium, and other associated bones, right? So, face, mainly how many bones? 14. Who's gonna count? I'm not going to ask you that number. So all I care is that you guys know the bones of the face, which you guys know that your face does not include what? The frontal bone, right? So maxillary bones, palatine bone, nasal bone, inferior nasal concha, zygomatic, lacrimal, vomer, mandible. Hopefully that's not a new thing that you're getting from me right now, right? Because, again, covering the lab. Cranium. Your cranium is made out of what? Occipital bone, parietal bone, frontal bone, temporal bone, sphenoid, and your ethmoid. So, cranial bones, what is the main function? They enclose the cranial cavity, and in the cranial cavity, they protect your brain. So, of course, which contains the brain, and of course, as well as fluid and blood vessels, nerves, and membranes. Okay? Which I'm not gonna dictate a lot about it, but please know this information because that's extremely important. After we finish with this exam, the next set of information, it will be just about nervous system. It's the biggest portion, okay? So in there, you need to know that you have blood vessels, nerves, and membranes that surrounds and protects both at the same time, the brain and your spinal cord, okay? So, we talked about skull protection, the brain, entrance of respiratory system. Where is that? Your nose and your mouth, right? You can breathe from both of those, right? So entrance of digestive system, which is mainly, of course, your mouth, right? And again, you guys are experiencing this the harsh way, especially you, which is the facial bones are actually superficial, of course, and then you have muscles attached to those facial bones, right? Again, don't worry about it. You're not going to talk about muscles in this one. So we're going to break it down again into a skull, vertebral column, and thoracic cage. That is your axial skeleton, including the sacrum on the bottom, right? Because your spinal cord, let me just go down, see if you guys remember. Your spinal cord is divided into what? What are they? Cervical, thoracic, lumbar, and finally, I'm just trying to make impact here with the colors, but it takes a long time for this to respond. Whatever, just made the same thing. So the sacrum, right? Everybody got it. Right. I don't know if you like it that way better. Yeah. So you have skull, cranial bones, facial bones. What are they? Okay. And then of course you have your associated bones, which I didn't specify a lot, but those are the hyoid bones, and ear ossicles. So how many ossicles do you have?
6.
There are 3 in each side. So the total is 6 because you have ears in both sides, right? And even though if you don't have the ear, the ossicles are still inside, right? So those are the malleus, incus, and stapes, which later on we're going to talk about those. Okay? Where's your hyoid bone?
What?
Hyoid. Where's your hyoid bone? And cervical area, right? So that's where your hyoid bone. If your hyoid bone were to get fractured, what could happen? It can compress the trachea and it can close your airway. So you can actually pass out, and then if you don't do it in time, yeah, you can die. So let's talk about the cranial bolt or calvarium. You're gonna have a question about it. I just put a little hat in there. So that is your cranial bolt, right? The one on top. Now the cranial bolt or calvarium is formed of the frontal bone, occipital bone, and parietal bone. Please note that your temporal bone is not included. Do you see it? That's a question. Okay? And of course, here you have a representation of what? The facial bones. So your skull is divided into what? We said face and cranium. Your skull is also divided into a what? A base and a roof. The roof is your what? Calvarium. And well, the face is where the actually brain sits on, correct? Okay. And then here you go. You should be able to recognize every single one of those bones, which are listed there in pretty colors. Okay? So, what are we going to talk about? Sphenoid bone. That's the one that looks like a sphinx. You have your ethmoid bone. You have on the base styloid process, mastoid process, okay? External auditory canal, zygomatic process, and your temporal bone. If you think about it, all the ones that I listed here, let me just erase those two, are just part of what? They're part of your temporal bone. So all those, your styloid, mastoid, external auditory, zygomatic process, that's all of them are part of your temporal bone. So in your test question, it will be which of the following belongs to what bone. So you need to know what belongs to what bone. Okay? Now, if we look at the sutures, it's going to be a little bit the same. And in the sutures here, give me a second, let me erase this one here. So in the sutures here, you have a suture that will divide the both parietal, and that will be what? That will be your sidal suture. We have the suture that divides parietal and occipital. We're calling that the lambdoid suture or parietal occipital suture. The suture that divides your parietal bones with the frontal bone, that will be known as the coronal suture. Okay? So just know the sutures, what do they do? Straight up. Or what are your sutures as well? Please know that the sutures are immovable joints, right? They do not move. On the fetus, right, on newborns, you have two major fontanelles. One is the anterior fontanelle, and the other one is the occipital fontanelle. These fontanelles are important because as they get ossified, they become sutures, right? So anything that can go across that thin sheet of hyaline cartilage can damage the brain of the baby, right? The newborn in this case.
How long does it go?
More or less, the occipital takes about 2 to 3 months. It doesn't take up to 6. It just depends on everybody, but it's not up to 6, it's less. Book says about up to 6. On the frontal bone, it's just about a year or less, right? They say about 8 to 10 months, somewhere around there. But again, every human is different, but that's the average. So you can see, of course, the anterior fontanelle and posterior fontanelles. And we talked about the sutures. So nasal cavity, we need to know what the structure of the nasal cavity is. So nasal cavity is divided by the nasal septum, which makes the nasal cavity into right and left. And in each side of those, you have a couple of nasal conchas. Some of them are going to be inferior, while others are going to be middle. And if you were to remove the nasal bones on the top here, the purple ones, you will see that you have the superior nasal conchas, right? The nasal conchas, the main function of it is to increase the speed of the air. It helps cleanse the air, warm the air, and humidify the air. So the nasal cavity is actually composed of a roof, lateral walls, and a floor. The floor you already know, and that is the hard palate. The roof is going to be what? The base of your skull, right? And that roof is formed by the cruciform plate of the ethmoid bone. On your orbitals, well, you need to know what the structures are of your orbitals, and this is actually listed in green. So whatever is medial, right? Medial located, you have your sphenoid, you have your ethmoid bone. Again, your sphenoid is the biggest one towards the back, right? Ethmoid is the smallest one, closest to your nasal bone, as well as your frontal of the maxilla and lacrimal bone. Okay, that's on the medial wall. On the lateral wall, everything in blue here. So again, you have your zygomatic process, your sphenoid bone, and you're going to have, of course, your zygomatic bone. So most of it is what? Zygomatic bone. Superiorly, you guys know is the what? Frontal bone. Inferiorly, you guys know is mostly what? The floor will be mostly what? Palatine, right? And then it's going to be your zygomatic bone, most of it, as well as your maxilla. Now, within the skull, you have a couple of air-filled chambers, and those air-filled chambers are known as what? Sinuses. So the sinuses are going to be the following. You have frontal sinus, sphenoidal sinus. You also have your maxillary sinuses, which is not here. I don't see it anywhere. But you also have your maxillary sinuses. So those sinuses, what do they do? Well, they're air-filled chambers, right? So one of the main functions is to make your skull what? Lighter. It makes it lighter. And at the same time, when you have a lot of mucus, the mucus, instead of going anywhere else into your body, the mucus will stay on those air chambers. So it wouldn't be air, it will be like mucus. That's why sometimes when you have the flu, you may have pressure on the front of your head or on the zygomatic bone, right? Or sometimes in the maxilla, like somebody's pressing, and that is the accumulation of mucus in there. Okay, so it's a way that aids the immune system to localize the infection and help in the fighting against the pathogen. So here you see a healthy sinus versus a inflamed sinus, right? Which you can see them there. So here you can see them better, I think. So you have a frontal sinus, sphenoid sinus, ethmoid sinus, and your maxillary sinus. Okay, so cavities that decrease the weight of the skull, lighten the skull, protects the respiratory system, again, because it helps with the immune system by fighting the pathogens, and they also work as a resonating chamber in your voice. Have your voice ever changed when you have clogged nose or just you have the flu? It does, right? All the time. So here on the base of the skull, the main thing that I want to take your attention to is this structure. It's called the hypophyseal fossa, right? And that one is on the actual sella turcica. So the structure is the sella turcica. In the hypophyseal fossa, which is just the indentation, that's where a special gland sits. That gland is known as the pituitary gland or hypophysis, hence the name hypophyseal. So that's one of the most important glands that we're going to talk about in 2086, right? In anatomy 2. So the chapter is 60% of it is just about the pituitary gland. So almost a whole chapter about that gland. So that gland is extremely important. And what is your hard palate? And this is actually going to be on the bottom. So the hard palate is what forms what? On the nasal cavity, what does a hard palate form? That palatine bone, what does it form? The floor, right? Just know that. So yeah, it is a palatine process, right? And the palatine bone, but that's what makes up the floor. That's the whole purpose here. And then there are two main orifices that you need to understand, and those are jugular foramen and carotid canal. The jugular foramen is pretty much where the jugular vein crosses or passes through, and that's the one that drains all the carbon dioxide and all the waste products from within your brain. Sinuses. Okay. Carotid canal is again, and if you look at it, those are more or less where your temporal bone is, right? Except the jugular. But the carotid canal, that's where the internal carotid gets in to your brain. So there is a main artery in your cervical areas, and that is known as the common carotid. The common carotid will split into external, that goes to your face, it gives you blood flow to your face, and then to the internal. The internal carotid is the one that gives you blood to your brain. That's why that carotid canal is important. So, two things that I told you, remember, carotid canal and jugular foramen. And here comes the pain. So, what goes through the cruciform plate? Through the cruciform plate, you're going to have your olfactory nerve. First thing. You can see it there, right? So in that cruciform plate, which is that green plate right there, is part of your ethmoid, the olfactory nerve goes through. Why do you care about the olfactory? Because those are the nerve endings that allow you to perceive what? Smell. So if there's to be any damage around that area, you will damage the capacity of doing what? Perceiving smell. Okay? If you go into a burning building and that temperature is really high, you can actually burn your nerve endings. You won't be able to sense smell. Okay? Same thing if you sniff something that, or if you inhale, or actually if you sniff something that is really strong odor, like ammonia or something like that, and you sniff it all the way through, that can actually burn your sensories, receptors for the olfaction as well. Okay, so the next one is sella turcica, foramen rotundum, lacerum, ovale, and spinosum. Those are part of what? Sphenoid bone. It's color coded. They're green, it's a sphenoid bone. So if you see any of these structures in a step of question, what would you answer? They're part of what? Sphenoid bone. The next one up is your temporal bone. So what are the structures of the temporal bone? Internal acoustic meatus, jugular foramen, as we mentioned before, right? Yes? And carotid canal. Those are the ones. So if you see any of these, it knows that there's a temporal bone. Finally, the occipital bone, the main one that I would like just to remember is what? Foramen magnum. And that's where your spinal cord connects to your brain. Okay? So what sits on the sella turcica? Here you go, sella turcica, and you can see the pituitary gland that sits in there. So that's the tiny gland that I was talking about before. Okay. For this one, we're going to talk about it on cranial nerves, so that is just to scare you guys. Vertebral column. We said the vertebral column is composed of cervical, thoracic, lumbar, and sacrum. Cervical is what? 7 cervicals. Thoracic is 12. Lumbar is 5, and sacrum is just 1, but there's 5 fused ones, right? If you look here on the side, I want you guys to hear for the first time. How many nerves comes out of the 7 cervicals? 8 nerves. Why? Because the nerve on the top, it goes below 1. So if it goes below 1, right, after 7, you have C8. Instead of coming out of the, remember you have the atlas and the axis, which is the first 2 cervical vertebrae, right? Instead of going at the level of the atlas, it goes below. So this is 1 more, so you have C7, so you're gonna have overall C8. So nerve-wise, you have 8 nerves for the cervical, 12 nerves for the thoracic, 5 and so forth, right? Same thing. That doesn't change. So what are some of the abnormal spinal curvatures? We have here our scoliosis, kyphosis, and lordosis. Scoliosis is a sideways movement, right? It's a lateral movement that takes your spine to be properly aligned, correct? And this is the most common around the what? Thoracic region, okay? Who's more frequently seen with this? Adolescent girls. Now, the next one is kyphosis. Kyphosis is like the hunchback, or the way I like to remember is it looks like a K. So that kyphosis is an exaggerated curvature, and most likely from osteoporosis. So elderly individuals tends to take place of this one. Or if you're a college student as well, right? Why college students? Because you put the book back and it weighs so much, you end up walking like this, right? Just to overcompensate it. That was a joke, anyway. So lordosis. Lordosis is actually when you lay back, right? So who's gonna lay back when they walk? Pregnant women and the parents of the pregnant, well, not the parents, the husbands of the pregnant women. Because as they get a big belly, the husbands get the same thing, right? The beer belly ones. No. I mean, they always say females, yeah, they swaying back. But, you know, a guy who has a big belly, you have to sway back. Because if you were to walk like this and your belly's like this, what's gonna happen? You're gonna fall into the floor, right? So that's not only for pregnant females. So what are the main 2 cervical vertebrae? We said it was the atlas and the axis, as you can see here on the top, right? Now, there are a couple of structures that you need to know out of these ones, and they're the following. So there is a orifice right here. I don't know if you guys can appreciate that one. So things can go through. like so. And there's another one, well, actually put it right here. So internal intervertebral foraminus. So the intervertebral foraminus is in between the vertebrae and your spinal nerve goes through it. So spinal nerves are known as mixed nerves, okay? So intervertebral foraminus, what goes through them? Spinal nerves. Later on, we're gonna talk about that, and you need to know that those nerves will be mixed nerves, okay? What is in between each one of your vertebrae? And that is known as the intervertebral disc, which are made of fibrocartilage. They help in cushioning. Now, the other one that is not intervertebral foramina is what? What is that foramina called? This one is intervertebral. That one that I'm showing on the top is called vertebral foramen. So one is inter means what? In between the vertebrae, right? And the other is just vertebral. So the vertebral foramen is the one that allows to pass through what? Your spinal cord all the way from the cervical all the way to the lumbar. Does that make sense? Okay. So what are some of the structures of each one of those vertebrae? You have spinous process. You have transverse processes, articulating faces or facets, and mainly the body. Those are the same in each one of your what? Vertebrae. Those structures are the same. So going back to atlas and axis, please know that on the axis is called an axis because it has a axis. This axis, well, is called the what? Dens. Remember, there's atlas and axis. The atlas of the cervical is the only one that does not possess a what? A body. So atlas does not have a body. It's the only vertebra that does not have a body. Write that down. Atlas, parenthesis or equal, does not have a body. Okay. The other thing that is specific for the axis, so right here, atlas, just write that down. It has no vertebral body, right? The axis has a specific structure known as the what? Dens. So who has a dense axis? So if you see the word dense, automatically you're going to answer axis, if you see that anywhere. Now, for all the cervicals, okay, what is there? So we talked about atlas, and we talked about axis, right? This one is no body, and the other one is what? Dense. For the rest of all the cervicals, cervical vertebrae, right? This is C1 and C2. For the rest of all the cervical vertebrae, what is there only to them? And that is that tiny orifice right here. Can you guys see the orifice right here? That is known as the transverse what? Foramina or foramen. Okay? So we're done with the cervicals. Now, we need to compare that with what? We need to compare with, we did the cervicals already. We need to compare with the thoracic vertebrae, right? These are going to be more massive. So as the vertebra goes all the way from the cervical to the thoracic to the lumbars, the body is going to be what? Bigger, right? The intervertebral disc should get what? Thicker as well, right? Because you're holding more weight. The main thing here is the spinous process, which tends to point downwards. The other one, what happened? Sorry about that, guys. I was uploading the video for the skin. So the other one that we have is the lumbar vertebra, and the lumbar vertebra, the posterior spinal processes are short, but they're even more massive as well. So we done comparing what? Cervical, thoracic, and lumbar. So if you looked at it, most of your questions, if I have a question about 1 or 2 questions about this one, is going to be on mostly what? Cervical, right? The transverse foraminus, atlas, or axis, right? Most likely the other ones. And then you have a table there as well if you want to read more about it, right? Table comparing those. We already talked about the intervertebral foraminus. These ones right here that is pointing out, those are known as your spinal nerves. Again, the mixed nerves that we mentioned. Again, those are intervertebral foraminus, right? Versus the vertebral foraminus. And the vertebral foramina houses the spinal cord. Have you guys ever heard of a hernia? Where does the hernia take place? Why is herniating? What is herniating? There's different type of hernias, right? So when they say, well, everybody calls it hernia because they don't, but the vertebral, the disc herniation, that's what probably is called, right? This is what is herniating. If the disc opens up and compresses a portion of your spinal cord, is that going to be painful? Yeah, also is your body going through there. So that's when they refer to a hernia. You have a herniated discs. That's what they said. Okay, a disc herniation. And then of course, finally we talk about the sacrum, right? Sacrum, that's just about it. Just know the sacrum, and finally you have the coccyx. Thoracic cage protects your soft organs, including your respiratory, cardiovascular, part of your cardiovascular, and major vessels around the heart, right? So on the thoracic cage, you need to know what is this structure right here first. What is this one? The manubrium, right? Then this next up, the body, and then finally this tiny one is called what? Xiphoid process. Everything here, those 3 structures are known as the what? The sternum, as I highlighted there. Okay. Now, the other thing that you need to know for this one is that each one of your ribs, or almost all one of your ribs, are attached to a cartilage, with the exception of 12 and 11. You can barely see 11, but that's here. Those are known as what? Floating ribs. So that brings up to the next thing. Your thoracic cage, or that ribs attached that makes the thoracic cage, are divided into 2 main types. One is true ribs versus what? False ribs. So 2 main divisions, true versus false. The true ones is 1 through 7, as stated here. The false ones is 8 to 12. Trick question. Within the false ones, you have the last 2, which they're not attached to any cartilage, so they are floating. Okay, so just be careful. When they say floating, just only 11 and 12. If they don't specify, what do you answer? False ribs. Okay? So appendicular skeleton, you guys don't know the appendage, right? The pectoral girdle versus what? Pelvic girdle, right? Which we talked about those. So what is the most frequent fracture bone in the body? Clavicle. What is the most frequent fracture bone in the pectoral girdle?
Ribs.
Clavicle. What is the most frequent fracture bone? It's the most frequent one. And the most frequent one they say, because, you know, if you need to, like almost everybody, right? You need to wear the seatbelt, and there's any trauma, any accident, when you force the car, right? Most likely that seat belt, it's going to put a big force on the clavicle, and the clavicle is a small bone, right? It's a thin bone as well. So that's why it's the most common fracture bone, right? It's the most fragile one. And then of course, you have your scapula. So scapula, what do you need to know about the scapula? That is part of your pectoral girdle. Know that the scapula has a spine. And if you see these weird words, acromion or coronary process or glenoid cavity, know that's part of the scapula. That's it. Why am I making emphasis on this one? Because that glenoid cavity, acromion and coronary process, is what binds to the head of the humerus, which is going to later on make a capsule, and then we call that a shoulder joint. Okay? So what sits on the glenoid cavity? The head of the humerus, right? If you see greater tubercles or lesser tubercles, please know that that is the humerus. If you see olecranon and fossa, know that is the humerus. See, I'm not going in a lot of details here. So all that the test is going to provide is going to be just a couple of structures and then just the name. For most of the bones, I'm not going to go in detail. So radius and the ulna. What about the radius? Radial tuberosity, right? And then you need to know your articulate facets. Why? Because that's what articulates to your wrist, okay? And then please know what is the function of that articulation, as well as the pivot joint of your radial head that is round, and that is allows you to do what? Supinate and pronate. What is supination? Asking for soup. Right? That's how I remember it. And then you have all these body movements that you're able to do, which you need to be able to know what they are. So what is abduction? Abduction is away from the body. My fingers abducted. And a deduction, right? Double D is fingers moving close to each other, or my hands or feet moving towards the middle of my body. Okay? That's adduction versus a deduction. Okay? You have as well as extension. Well, this one is kind of weird. So you have flexion on my head, flexion, extension, and hyperextension. In the trunk, flexion, extension, and hyperextension. Does that make sense? And then you have supination, pronation. We did protrusion or protraction, retraction, which is your protracted or retracted. Have you ever done that before? You do that all the time. When? When you're chewing, when you're eating. You do that all the time. And then, of course, we have circumduction. I don't like the way that it's shown there, but circumduction is what? Making a circle. Which joints allow you to make a circle? Your ball and socket joint. You need to know that. So the main two ball and socket joints that you have is one is your shoulder joint, right? And then you have your hip joint. Okay, those are the most freely movable joints. You need to know that. And then finally, for the foot, you have inversion, and eversion is just pointing out, and inversion is just pointing them inside, right? And in dorsiflexion, plantar flexion, it tells you what it is, right? So plantar flexion is you put the plantar, just flex it, and then dorsal just move it out. That's it. For the hand, please know that the hand contains the carpal bones. I'm not going to ask you how many are there. know that those are metacarpals as well, and then 4 is phalanges. On the phalanges, know that not all of them have a you're guessing, right? So not all of them had a medial. Look at the thumb. Proximal and then distal. The other ones have what? Proximal, middle, and distal. Okay? Your thumb is the only one. It has a proximal and distal. And then we go into the pelvic, which is basically have an ilium, ischium, and pubis. Ischium is most of the time where you're sitting, especially on top of the ischial tuberosity. That's where you have the attachment of some of your gluteus muscles. Pubis, well, you guys know what the pubis is, right? Your pubic area. So that's what makes up that pubic area, that hard structure in the pubic area. And then you have this structure right here. What is this structure, guys? Can anybody tell me what the structure is? That binds to the head of the femur. Acetabulum, right? So yeah, that's definitely one that you need to know. The acetabulum. Oh, that came out really bad. So the acetabulum. You need to know that. What binds to it? The head of the femur. The other ones that you may need to know is obturator foramen, as well as the greater sciatic notch. The obturator foramen, there's a nerve that goes through there, and that's called the obturator nerve. For the greater sciatic notch is another nerve, and that is the sciatic nerve. Have you guys ever heard of sciatica? It's a pain that starts on the butt, like somebody stabbing something in your butt cheek, all the way down the leg, all the way into your calcaneus. If you ever felt that pain or radiating pain, which is called, that you're experiencing sciatica. Okay? And you can do it by, well, you can elicit this by doing what? A lot of what? Squats. Right? Or going up the stairs, right? And then, of course, we have the pubis symphysis, right? Again, pubis symphysis is the slightly movable, is a amphiarthrosis. And this one is nice because this one comes into play with something that you can use. So normally in pregnant female or females that they're doing their pregnancy or they're actually trimesters, they are going to measure, right, what is your pelvic inlet and what is your pelvic outlet. Okay? The pelvic inlet and outlet is measured just because you want to find out how big the head of a fetus could be in able to pass through there, correct? And they assess you through your trimesters, right? First, second, or third trimester. So if your pelvic outlet, in this case, right, you have these structures right here, which are the spines. If they tell you that you cannot have the baby natural birth, right, vaginal delivery, and you say, no, I want to, there's a reason why they're saying you cannot, because as the head of the baby passed through there, what's going to happen? It's going to scrape the size of the head of the baby. As we mentioned, you had an anterior posterior fontanelle, and as well you had a lateral fontanelle, which I'm not going to make a big deal about it, but you're scraping all that, and now you're exposing the baby to have a what? A caput cutaneous, damage to the layers of the skin, the skull, and even including the brain. So you may have to sign a consent if you want to do your will. Most of the time, right? What happens naturally? Naturally, we have the pubic symphysis. So as you're about to give birth, your pelvic outlet is going to do what? Increase. So every single female, or almost every single female that have given birth before, their hips are wider than what they were before. Why? Because it widens it out. Okay? Again, it doesn't widen out by 10 centimeters, guys. Okay? Just a little bit. It's about 1 or 2. And then, of course, some of that they retrace back. So what is the difference between a male and a female? So a male and a female pelvis. Well, the male one is, the angle is just about 90. Well, this is about 100, right? So there's less. The ischial spines are narrower. So the pelvic outlet, of course, are we built to have babies, guys? We haven't met the first men yet. Okay? Probably. Anything is possible. So, but highly unlikely. So pelvic modification. What is happening on pelvic modification while child bearing? So you have enlarged pelvic outlet, broader pubic angle, a less curvature of the sacrum. So normally the sacrum of the males are like this. Females will tend to open the sacrum a little to the back, right? So more circular pelvis, so this is more wider, as you can see there, broader, and it projects farther laterally, okay? Because it widens this pelvis. Femur, what about the femur? Greater trochanter, lesser trochanter, okay? Know that the head binds to the acetabulum. And please know that the medial condyles of the femur makes up later on, as they attach to the tibia, makes up what? The knee joint, okay? The knee joint. So here's the femur. Here's another femur, same thing. And then we're going to talk about the tibia. So on the tibia, you have lateral condyles and medial condyles, where those are the ones that attaches from the femur, okay? And that's what makes up the knee joint. So the knee joint is made mainly by two bones. One is the what? The femur and the knee joint is made by who? Femur and tibia. The knee joint and elbow joint are what type of joint? They're called hinge, because they can move only 180 degrees, right, on one axis. So it's like the hinge of the door, right? It just opens and closes with just one axis. And then on the foot, you have tarsal bones, right, which are your calcaneus, talus, and then you have your metatarsals and phalanges. The same thing applies, right, for proximal and distal on the big toe, okay? And then we have foot arches. I don't know what you are, but I know what I am. How many of you have gone to the Dr. Scholl's machine? You stand on it, and it tells you the arch of your foot. You never seen that machine? It's in Walmart, CVS, a couple places. So it tells you pretty much what arch you have. So if you have, you are what your bodies are, right? What your foot is. So if you have an improper footing or improper shoe, most likely towards the end of the day, through an exacerbated day, not a day that you're sitting, but through a day that you're actually walking on top of your body, on top of your shoes and the feet, most likely you're going to end up with what? Pain where? In your back, and you're going to feel tired than normal, right? So a normal arch, that's what it looks like. A high arch. People with high arch, if you look at it, they tend to walk like this, with the feet pointing inward. Unconsciously, of course, right? People with a flat foot, most likely when they walk, just look how I walk. Pointing the feet outward. That's how I walk. If you point it, this is again unconsciously. If you point your feet to the front, that's the way you're supposed to walk if you have a normal arch. So if you want to force yourself, you can do that. I feel kind of weird if I do that. I feel out of balance. So, okay. So what did that lead to? Well, a stress on your plantar fascia, we call plantar fasciitis, right? Which is if you actually run the next day, you've never run before, and you decided that you want to be a marathon runner, and you decide to do that day, 10 miles in one day. The next day you're like going off, so you can have a plantar fasciitis, which actually is an inflammation of the fascia of your feet. Okay, just rest, elevate, right? Compresses, cold compresses, and anti-inflammatory medications, which is aspirin. So, and then you have another one, which is the weird one, which is called pes cavus, right? Or pes cavo. So pes cavus means what? Asian cultures, right? Females with smaller feet.
They would like.
This is back in the day, right? They'll do what?
Do foot binding.
Right. They bind their foot into a small shoe. I don't know why they do that. I think that's kind of like some sort of torture, right?
No, it was mostly done by males because.
No, I know it wasn't a torture. It's just that's
Yeah.
the way that. But to me, it was a torture at that time. I mean, it was
Males,
seen normal.
Males didn't want women to like
Have
work.
big feet or have bigger
Work.
feet than they. Yeah.
It was like they didn't want to work, so like when they were foot binded, they couldn't get up and they had to depend on them, so they couldn't like go out and work and stuff. Which is why poor people couldn't do that. There's only the rich people that could do that.
So learn from history. So treatment for flat feet. If you have a flat foot, what do? If it hurts, you do what? Rest, ice it, elevate it, right? Stretch, exercise, pain relief medication like non-steroidal anti-inflammatory anti-inflammatories, which is your NSAIDs, physical therapy, and then if that doesn't work, well, the next thing is what? Orthotic devices, which is what? A shoe made for your feet. But, well, those machines came up, and then now you can put what? What do you can put on your shoes? Insoles, right? And then those, you don't have to wear a special shoe, which is a lie. Some of you, if you guys were used that before, not all shoes are capable to hold those. Because sometimes on the back of your ankle, it's just too high, and then your shoe will fall off. So it has to be a tall shoe. And you cannot have a bottom tennis shoe wearing that, something like that. So as you get older, what's going to happen? Your intervertebral disc becomes thinner. They're less hydrated. The discs are less elastic. So you have a higher risk of disc herniation. Okay? So loss of stature, it takes about centimeters, and that is most common after age 55. Your costal cartilage, capacity of breathing in or breathing out, that it decreases with age because your costal cartilage are going to ossified. Okay, so your thorax becomes more rigid, so your breath will be like instead of expanded all the way through, right? So, of course, all bone loses mass as you get older.